Hello, I'm Ted DeWeese, Interim Dean of the Medical Faculty and CEO of Johns Hopkins Medicine. It's a real pleasure to welcome you to this installment of the Johns Hopkins Health Policy Forum. This series brings together leaders in the field to discuss our most pressing health challenges and how we can address them through policy making. For today's fireside chat, I'm just truly thrilled to welcome Dr. Sudip Parikh, CEO of the American Association for the Advancement of Science, the AAAS, and executive publisher of the Science family of journals. With Dr. Parikh at the helm since 2020, the AAAS has become, I think, the tip of the spear for science advocacy in DC. I think really at a time when the threats to the things that we value, research and discovery, are truly existential. He's had a long and illustrious career in science and in business and in government, including in product development at DIA Global and leading R&D at Battelle. He honed his political skills, negotiating budgets for scientific and health agencies, including the NIH, as well as the CDC, as a professional staffer for the U.S. Senate Appropriations Committee. Serving on numerous boards, including Research America and ACT for NIH, Dr. Parikh has emerged as one of the most recognized and powerful voices for science in our community. He's deeply committed to maintaining U.S. primacy in research and development and educating scientists for tomorrow. I know we're going to learn a great deal about him today. Sudip, welcome. It's a real honor for me and an honor for us to have you as our guest.
Oh, Dean DeWeese, it's an honor for me to be here, and thank you so much for the invitation. Looking at those pictures and hearing that introduction, I'm so humbled. I don't even know how to get started on this. I'm looking forward to the conversation, and I also think maybe I shouldn't have shaved today because it looks like in all those pictures I didn't.
Well, I didn't shave my upper lip today, so I guess we're sort of even in that. Well, let's jump right in. You and I had the opportunity to chat a little bit ago, and I heard you say before and then during our conversation that this today is kind of the golden age of science, and I thoroughly would agree with that. There's converging factors that give us tools to do things we could never do before. I think it's just an amazing time to be a scientist right now. How do we take those discoveries and translate them for the American public to give them some sense of the awe and wonder that I feel as a scientist?
Yeah, no, I so agree with that, Ted. When I think about as a kid, I used to imagine what it'd be like to have breakfast with Einstein in 1905. What an amazing year for him, or Isaac Newton in the 1620s, or you can go on and on to the folks who were working out the central dogma of biology in the 1960s and 70s. What remarkable times those were. And I used to think, boy, wouldn't it be wonderful to live in one of those golden eras of science? But in reality, now after 3 years in this job, I realize that we are living in perhaps the golden era of science. Whenever you look at all the disciplines that are making progress, we know more about the universe, we know more about the planet, we know more about ourselves than we ever have. And that is a golden era of science. Now, there are lots of problems, there are lots of challenges, there are lots of problems, even with the scientific enterprise itself. But all that said, we are living in a golden era. And it's tough because there's a disconnect between that reality and the perception of many. And that is not just the fault of the general public, whatever that phrase means. It's not the problem of just policymakers. It's a problem also of the enterprise itself. In many ways, we have a hard time communicating the beauty and the wonder and the utility of what we're working on. And so we've got to make sure that we are becoming better science communicators, not just a few people, not just one or two people, but rather that all of us as a scientific enterprise are better communicators, because it's going to take us being a part of our communities to actually heal some of this disconnect that's occurred over the past few years.
I wholeheartedly agree with that. And maybe an extension that I'd love for you to just opine on just a bit is, if that's the reality, how is it that we lost so much trust, we as a community, amongst a larger fraction perhaps of our U.S. population? I know there's, we have a history of this country of at times being naysayers about a lot of things, and that's just sort of the nature of an independent society like we had. But when you think about what happened through the pandemic, that lack of appropriate discourse, I guess one could argue, in some places costs people lives. And so what do we do? What do you think?
Yeah. You know, someone said something to me which I thought was really telling, which is that trust is gained in teaspoons and lost in buckets. And I do believe that. And during the past few years, we've had challenges in how we communicate. We've had challenges in how we communicate, but I think there's something even more important. It's part of a bigger thing that's happening, a bigger megatrend that's happening in the world, which is that we are polarized. There was a couple of papers out in Science just yesterday about the polarizing effect of Facebook and the algorithms in Facebook. And what's happened is, as we've retreated to these corners, something truly significant has happened, which is that belonging is becoming just as or even more important than truth. Belonging to a group, belonging to a faction has become more important than truth, because there is more cost to not being part of that truth than there is to believing the truth, to not believing the fact. And so we have this incredible challenge to overcome of how do we begin to fix that? And this is not going to be fixed in any one small way. There's no $300 million ad campaign in the media that's going to fix it. It's going to require teaspoons. It's going to require scientists actually being trained communicators in their communities, participating in their communities, building levels of trust. I come from, I was born in Hickory, North Carolina. I grew up there. And I get why people have a distrust of institutions and elites. I get why they don't necessarily want me to come in and tell them that this is a time not to go to church. This is a time not to speak together in restaurants and gather. I get that. You can't be coming in to solve the problem, parachuting in and parachuting out. You have to be a part of that community. And so we've got to start building those bridges. At AAAS, we have lots of programs that build bridges with faith leaders, with policymakers, with journalists, so that we can then have the ripple effect of those folks in the community saying that they, as their influence across the community spreads, they can say that they trust a scientist. And this is going to take a long time. This is not something that's going to be fixed overnight. The thing that gives me hope is that when I look at some of the polling data and the survey data, it's not as bad as we might sometimes think on our worst days. There is still a lot of trust in scientists and the scientific process. We've got to do a better job of explaining what that scientific process is, and that we don't know everything. We got to be humble about it. But there's reason for hope there, and reason for optimism. So, but we've got to work at it as scientists and physicians.
Well, I really appreciate that latter point about what we own, for sure, in that, and that being the part of the community is what's going to be able to drive part of the trust that's required. So maybe juxtapose that a little bit, Sudip, with your time in the Senate. Where do you think the bipartisanship is or is not around that? Because that does, all politics is local. Ultimately, if your local congressman, senator, congressperson said it was good, maybe people listen it a little bit differently. Where do you think that dialogue is around science?
Yeah, I put it in two places. One is around biomedical science, biomedical research, and then all other science and technology research. I would say that there is tremendous bipartisan support overall for science still, even today. That has not changed. And what we see is that the United States is still a very large investor in science and technology, and that is the good news. The bad news is that in terms of biomedical research and biomedical science, the last few years have really done damage to the bipartisanship and the bipartisan support of biomedical research, particularly at the NIH, but also at the CDC, FDA, other government agencies that are involved in biomedical research. And where that stands now is that there are, for the first time in my memory, there are politicians who are both incumbents and also those who are trying to get into Congress who are using biomedical research and the NIH in particular as a bit of a punching bag, raising money, saying they'd like to dismantle the NIH. And the reality of that is hard to contemplate. But the perception, the fact that there are folks raising money by saying that they'd like to dismantle the NIH is really troublesome. Now, it's a small faction at the moment, but the fact that it is different from the levels of bipartisanship we had in the past is really troubling. Now, when you look at the leadership of the Congress, the Senate and the House, the folks who are in charge of appropriations for those entities, they still get it. They still get it. They get that the investments in NIH and in biomedical research are truly important and have the effect of developing treatments and giving hope to patients, and of creating discovery and technology that leads to economic progress. They get that, but succession happens. People age out, they leave the Senate, and then we end up with a new cast of characters. It's on us as an advocacy community for science and as scientists who are at the bench to make the case constantly. It's a never-ending education, and I know that Johns Hopkins participates in that as well.
Indeed, we do. It's really our lifeblood, as you know, Sudip. Maybe continuing in a similar theme, with the hope that we have and that you've articulated that investment in biomedicine, biomedical research, scientific research more broadly is something that we will continue to do. How do you juxtapose that and our continued preeminence and competitiveness, frankly, with other countries, China perhaps is included? How do you see that struggle? Where are we? Where are we not?
Yeah. Let me step back for a second and think about the big picture here. So, on our best days, on our most optimistic days, you can imagine a world where scientists in the United States, who are some of the most well-funded and largest scientific enterprises in the world, scientists in China, scientists in Europe, scientists around the world, are able to collaborate freely, are able to move freely, are able to participate at the crossroads of science, whether that's in Baltimore or in Boston or in London or in Suzhou. Are able to do that and collaborate, and are able to, to heal the sick and feed the poor and protect the planet. That's possible. But there's another possibility, which is that that we retreat to our corners, that we fund science only for competitiveness, but build up walls between parts of the world, and instead of investing that research and that intellectual capacity towards those wonderful things that we should be doing in collaboration, we're doing it in protective measures, a protective crouch, whether it's defensive, defense or ways to harm one another. Both those future visions are possible, and neither one of them is inevitable. And what makes it not inevitable is how we, as a community, and how we, as a country, choose to go forward. It's a choice. And by investing in science, we have to invest in science, not just to be competitive. It is important to be competitive. Look, when we get to the place where we have a cure or prevention for Alzheimer's, it's not going to matter to me if it was invented in Chicago or if it was invented in Beijing. Yeah. It's going to matter that it's done, that it's happened. On the other hand, I would like for it to have been done in Chicago, because I think that that's part of our competitiveness, part of what draws the next round of innovation and cure. And so we've got to be able to keep both those thoughts in our heads at the same time. And we've got to be able to communicate that to our leadership, because what happens is these things it's either a virtuous cycle upward or it's a death spiral downward. Once you are no longer in a leadership position, it's very hard to get back there. Ask Europe. At the turn of the century, the turn of the last century, Europe certainly had much more science going on than the US did. And once that economic incentive and the health incentive continues to build on itself, it's very hard to catch up if you're in second or third place. And so we've got to make sure that we're able to communicate that fact, that just holding still, maintaining where we are is not enough. But we also have to be at the same time able to communicate that collaboration across international boundaries, so that intellectual capital is able to move freely around the world and able to inform and enrich our societies. That's a powerful thing that we can't let go of.
Oh, God. Sudip, thank you for articulating the way you did. We have ultimately a moral and social contract for improving the health of human health. I didn't say American health, human health. And I totally wholeheartedly agree with that. And, part of historically what's gone on well, I think, arguably speaking well, is our ability to attract graduate students, both domestic graduate students, foreign graduate students, to be able to perpetuate, the virtuous cycle of science, of medicine, of biomedicine, the translation of it. And I know there seems to be, and I know you've talked a bit about, where we might be close to, or maybe some would argue in a crisis of graduate school education. Give us some thoughts about where you think we are, because I think that feeds in large part into what you just described.
Oh, it absolutely does. It absolutely does. I've tried to speak out about this as much as I can, and there are multiple threads to this story. We can start with the international story. So, if we're going to, well, let's take a step back. When I first started looking at the people, the individuals who were involved in the development of the mRNA vaccine, I looked at the individuals and the institutions, but I looked at the individuals. It made me proud to be here in the U.S. because you looked at the identities of those people, and there were white men and white women, black men and black women, immigrants from all over the world. There were people from government, people from academia, people from industry, all involved in getting that innovation into people's arms. When you look at the helicopter placed on Mars, same thing. You see that, and you realize that diversity of thought and diversity of experience is it's not an exception, it's the rule in amazing scientific teams. And then you start to talk about the fact that, well, if we're going to do the next thing, if we're going to cure disease, if we're going to see a return to the moon and Mars, if we're going to create more economic opportunity for those around the world, it's going to take everybody. It's going to take people who are the descendants of Native Americans, of enslaved peoples, of Mayflower, everybody. It's going to take recent immigrants. And so we've got to be able to recognize that that's been a strength of the United States for such a long, long time. We also have to recognize that if we're going to compete in a global marketplace against what Ron Daniels has called demographic behemoths, we've got to pull from all parts of the United States, all the talent we have here. And that means that we need to make it to where no matter where you're born in this country, whether you're born in Cambridge, Massachusetts, or the Mississippi Delta, Appalachia, or the Central Valley of California, you feel a sense of belonging in the sciences. You feel welcome here because we need your brain power to solve these problems. The next thing we've got to do is once we get you here, we have to create an enterprise that is welcoming. And one of the things that we've done, we've over the course of time, incentives shape a culture. And one of the things that we've done is graduate students and postdocs and folks that we call trainees are in difficult positions. And I sometimes call it that, some of us look back at our own time in graduate school and postdoc through sepia-colored glasses. We reminisce about how hard it was and that sort of thing. But it's qualitatively and quantitatively different today. And that is something that we need to be thinking about as leaders, because our graduate students and our postdocs and our residents, they're not just trainees. They're learning, and that is an important part of what they are. But they're also providing educational opportunities for undergraduates. They are teaching. They are providing care to patients, and we've got to figure out a way to make that culture, that enterprise, that place of work for the next generation of scientists seem welcoming and seem like a place you want to be. Otherwise, we're going to have trouble. We're going to have trouble because we've got these pathways coming internationally, and we've got these pathways coming from inside the United States. Both are under pressure at the same time. And we've got to make sure that we are thinking holistically about the future and saying, what's it going to take to ensure that in 2043, 20 years from now, we're going to see the same level of intensity, the same level of innovation, the same level of creativity with the broadest possible lived experiences at the table. And I think that's a place we can get to, but it's going to take hard work.
Got to take some hard work. And indeed, I remember being a postdoc. I think I walked both ways to Hopkins, and it was uphill both ways when I was a postdoc. So yes, I fully appreciate the sepia colored glasses issue. Let me ask you another, not switching gears too much, but the linkage perhaps between, a pathway or a pipeline of scientists across all the places where those scientists would be employed and contribute, and what you have learned in your business time in industry, what that pipeline might mean, but what else could we learn, do you think, are positive lessons that we as academics, we as trainees, we as scientists in this kind of world could learn and maybe be improved upon?
Yeah. When I was a graduate student and I was doing very basic research, my advisor, he didn't have the greatest view of industry. He thought, well, they engineer stuff. We make the discovery, they engineer stuff. And so I started with that idea in my mind. But as I started to work in industry, as I was able to work back and forth between academia and industry and government, what I realized is that there is incredible expertise in different facets of what's necessary to get to discovery, in what's necessary to get to scale, in what's necessary to get to economically possible treatments that are living in all those sectors. And then the next thing I learned is that over half of scientists and engineers are working outside of academia.
Yeah.
Well over half. And you start to realize that instead of the tension that's there, or the competition, or sometimes the devaluing that takes place, there's actually real value in understanding each other's strengths, understanding what we are best at, and how to collaborate, how to be able to move back and forth across those sectors to work on behalf of the people that are funding our work. And I have to tell you, I've seen Nobel Prize winning work in industry.
Yeah.
There are places where I am just fascinated by the scale of impact that has happened because of the work in industry. And there are times in academia when I've seen the ability to get to something that is economically feasible and to market. Both those things are possible, and they can only be done when they're learned across sectors, learned from one another. And so what I've really tried to legitimize and hope that the AAAS can help legitimize is that there is scientific achievement, scientific excellence in every one of those sectors, and that policy is important as well, and that the economics of how to make these things a sustainable financial model is important as well. The sectors that fund science, not just the federal government, but also private funds, philanthropy, all these things form an ecosystem. And we've been very fortunate. It's grown organically in the United States without there was not one person that designed it all, but it's grown organically. And what we have to do is nurture that. And the one way to do that is by breaking down some of the barriers, breaking down some of the ill-conceived notions that some of us still carry. Not all of us. I think it's gotten better.
It has. Is there some direct, new forum to drive to create these kinds of relationships? Specifically, I'm thinking a company like Battelle, you have great insight into, and a place like Hopkins or an equivalent place that provides those learning opportunities. Where does that happen? How would you conceive that?
Yeah, if you look outside the biomedical sciences, if you look in engineering, there's much more movement back and forth across the barrier of industry and academia. Folks who've worked in industry sometimes come back and work in academia, and the metrics that we use to measure their expertise or their experience translates well. In the biomedical sciences, it's harder. It's harder because the metrics sometimes that we use to measure the expertise of folks is different in academia and in industry. And so one of the things I would love to be able to see are, and I think are happening around the world, are first of all places for entrepreneurs and residents to be embedded in academia, who bring some of that experience of getting a discovery from the bench, proverbially to the bedside. having that experience at the table, not in a seminar and a webinar, but rather embedded and as a part of the team is so important. But also doing that at the junior levels. We've seen cases where senior people in biotechnology and in industry go back into academia, and even they have a hard time sometimes getting back into the grind of getting an R01 or a grant from the NIH. But having junior people go back and forth is even harder. And I think we've got to be more open to that, because we have these skill sets that I think are just so fundamental and so valuable to both sets that we've got to make it possible. And the thing that AAAS can do is we can legitimize that by, those metrics, awards, recognizing people. When you have an award, when you've got a publication in one of our journals, or you've won an award from us, that is something that goes on your CV and is part of the metric that is used. Well, let's make sure that we are recognizing those folks who are doing industry work as well, so that they can have a metric that's recognized by their academic peers.
Yeah, I love that. I love that. So, Sudip, with maybe a thread of that, you have, besides your running the AAAS, but it does come along with this wonderful set of journals, and there's the one on the wall right there behind you, yeah, which are highly, highly influential and obviously in the world of science. Where does publications like yours, Science, of course, but the other prominent journals, what is their role and responsibility, not just in the communication of outstanding science and the review of it, but in the policy domain? Is there a role? Is that starting to bleed into a place they shouldn't be? What do you think?
Yeah, we'd be really careful about that. We'd be careful. One of the things that I've talked about when I first got here is that the AAAS has some things that it's trying to accomplish, and those things are laid out in a vision statement and mission statement, just like most institutions. The journals, Science, and the family of journals, are a part of that mission. They are not separate from it. And so when our vision is that we're going to have a mobilized scientific community, an inclusive scientific community that is able to affect progress for the planet, that mission, that vision needs to be implemented also by the journals. Now, what does that mean in practice? In practice, it means we absolutely, first of all, our very first goal is to advance science, scientific excellence and achievement, recognize achievement. Certainly, when you publish a paper in Science, that is an extraordinarily important thing to do. Now, does that mean that every paper in Science is right? No, it doesn't. That's part of the scientific process. It means that there is some reason why curation that is done by the professional editors here felt like it was important to be there. But it's the start of a conversation. But then there's the next piece, which is that when there's a paper about methane emissions, there's a wonderful paper about methane emissions in Science recently that was using satellites. Researchers were able to pinpoint where the largest sources of methane are on the planet, with very high specificity. And what you realize is it's around places where fossil fuels are being refined. And then you realize that there are certain countries doing better at this than others. The U.S. actually does relatively well on a relative scale with some of our places internationally. That information is important for policymakers. It's really important for policymakers. So how do you then get that out into the world? Well, it's important. I believe in something called situationally appropriate communication. And so I have a hard time reading the paper about methane. It's not my field. I can understand maybe the abstract, maybe, and then deeper into the paper, I get lost. We have to be able to have situationally appropriate communication. And what that means is when we are publicizing this for journalists and others who are then going to ripple into policymaking, we need to make sure that we have translated that ourselves to make sure it's accurate, because jargon is the enemy of communication. It's the enemy of good communication. We have to go take that out, make it possible to read for others. And that's why a journal like Science has science writers who are then taking that amazing research and translating it for others. It means having an insights section where scientists can then have disagreements, arguments about science. There's a controversy going on right now about superconductivity and whether or not we've achieved room temperature superconductivity. Now, the stakes are incredibly high. It's not as high profile in the public's imagination, but it is incredibly high, and it needs to be borne out in the pages of science. Now, that means that we're going to get into controversial subjects. It means that we're going to get into places where things get uncomfortable. But there's an important value to that. There's an important value to that. And I believe that it's a crucible. Science at the end of the day is a crucible where we take things, we put them under heat, and we see what happens. And we have this faith in the process that it will lead to a better understanding. A better understanding that the next generation may overturn completely, but at least to a better understanding than the one we've had before. And so I think that these journals, and they're not all the same, by the way. I just want to make them clear. Science is a journal that is run by a scientific society and is one of 6 journals. It is not part of a large commercial publishing unit that has 3,000 journals. And there's a whole lot wrong with the business models of journals, and I'd be happy to talk about that another time. That'd take another hour and a half. But there's so much importance to the influence that these journals have, and it's a part of the conversation, but it's not the only conversation.
Yeah, no, well, and I've had letters back from your editor saying, perhaps my paper would be better communicated in a different journal. So that's yeah. Not that I'm bitter about that or anything.
Yeah. Hey, Ted, I had 3 papers that were rejected by Science as a graduate student. When I got this job, I went to Holden Thorpe and said, I think these are still relevant, but he wasn't buying it. So.
Yeah, exactly right. Maybe a big switch of gear, Sudip. Knowing where we landed now, only 20 more years is going to tell what we should have or could have done better with respect to our SARS-CoV-2. The science engagement, the public health engagement, the delivery side of it all. But, if we had to have another pandemic, unfortunately, and then of that scale in, the relatively near term and perhaps in our lifetime, what do you see as, from a policy side, what did we do well? What do we need clearly to improve upon?
Yeah. There's so many lessons to be learned. So one of the things that I think is really important is for us to turn a light onto ourselves as the scientific community and be really honest about what worked and what didn't. And that will, the thing I worry about in that is that it can sometimes lead to this heated argument and blame. And then because of the polarization that's happened all across our country, it can lead to real hyperbole about motives and that sort of thing. And I think we've got to be really careful about that. I think we've got to be able to pull back and look at the framework and say, all right, let's assume best intentions, because I've known the people involved in that response. I've known the people that have been involved in the public health apparatus. There is incredibly good intent in all of that. And so then when we recognize that and we say, all right, now where were the things that worked and where were the things that didn't? Then there's not a value judgment about what's happened there, but rather a rational look at, well, what parts of communication worked and what parts didn't. And if it didn't, it's not because that person had malintent. It's because it didn't work. And we all make those mistakes. We have to invest in that, though. One of the things I really worry about is that we spend our time on arguments that are important, but that can be policy rabbit holes because there's not an answer yet.
Yeah.
And here I'm talking about things like what is the origin of SARS-CoV? I don't know the answer. I know that there is a lot of science that you look at that is peer reviewed that says one thing. There's a lot of intelligence that tells you something else. I get that. I get the reason why people have a discussion about this. That said, we really ought to be thinking about what is the surveillance network that we need going into the future that will help us find potential pathogens in the future, regardless of what their source is. We need surveillance. We need surveillance internationally, and we have to invest in that. Some of the ideas around creating platforms for vaccines, so that we already have the precursors of vaccines for different subtypes of viruses. Really important work that probably ought to be done. There's a lot of work to be done about how do we continue investment in our public health infrastructure around the country when there's not a crisis. This is what happens inevitably: is there's a crisis and we invest, and then we start trying to save money because things are good. And we have to recognize that that comes in pendulum swings. It's a really tough area, but it's one that we have to take on. It's one that we as people who care about the healthcare system, as people who care about the biomedical research enterprise, and more importantly, people who care about the lives of patients and people in the United States, we have to take on, even when it's messy and even when it's a little bit uncomfortable.
Yeah. Well, thank you for that super thoughtful response, Sudip. I know we're about getting ready to wrap things up, but one more topic before we leave today. We asked the audience to submit their questions, and there many of them sort of coalesced around the notion of artificial intelligence, not too surprising.
Yeah.
I know it's a topic that evokes strong opinions for whether it's overrated or underrated, or how it's going to influence us, or the end of civilization is going to happen tomorrow. And but they're all really relevant. Where is it that you're seeing AI in science, how it might change what we do, and then government's role in its, if you will, regulation, for lack of a better term?
Yeah. There's some immediate things we had to think about here at the AAAS. The editors at Science had to have the conversation about, well, would we accept a paper that that was partially written using one of these generative AIs? And would we use figures that were created through generative AI? And those were really urgent questions, because frankly, we were starting to see some of this. And one of the lessons that we learned going back into the late 90s and early 2000s is that new tools may have downsides or implications or consequences that we don't realize. Photoshop is one of those tools that in the early times when Photoshop first arrived, journals didn't recognize what's a valid use of Photoshop and what's not a valid use of Photoshop. And you're still seeing repercussions from that today in the scientific literature. And so one of the choices that our editors here have made is to be small c conservative about the use of AI in authoring publications, in creating figures. If it's fundamental to the project, so for example, work on AI that is used to predict protein structures. Mm-hmm. Obviously, the AI is fundamental to that research. But if it's about writing the paper, we've said no to that for now. For now, this is likely to change over time. But we wanted to make sure that we didn't end up polluting the scientific literature in ways that we may have in the past. The bigger question then becomes, all right, so what does this mean for the sciences overall? What does it mean when you can design a drug or a compound using generative AI? Who gets credit for that? What is where is the scientific credit for that? How does that work? So there's that layer of the onion. Then the next layer of the onion starts to happen around, well, what does this mean for society? What does it mean for how these generative AIs are trained? And then you get really worried, right? Because if these generative AIs are trained on the internet, well, I'm really careful about what my 12-year-old girls can search for on the internet, because the internet is amazing and a cesspool all at the same time. And one of the things that sometimes is missing from the internet is peer-reviewed information that is contrary to, or that is different from the perception of some media outlets. And so we have to make a choice about what of our content is going to be available for the training of these AIs. And I lean toward make as much of it available as possible, because frankly, I want them to be smarter. I want them to be more thoughtful about the world as it is, not as the internet sometimes portrays it. And then there's the next level of the end, which is that there are incredibly broad implications for these tools on society, and in healthcare, in education, in manufacturing, in almost every domain. And that is going to be the role of Congress and the government to start parsing through. The problem is that there's no one immediately on the receiving end in Congress to understand what's being said. So when the CEO of OpenAI goes to testify, who's listening? I worked for Senator Ted Stevens for a while, and I loved Senator Stevens, but he was famously quoted as saying that the internet is a series of tubes, and that wasn't that long ago. And the understanding of technology is not always the best in Congress. And so one of the things that we're doing at AAAS is making sure that we are fulfilling some of that expertise by recruiting a special cohort of AAAS Science and Technology Policy Fellows that will be embedded in Congress for the next year with AI domain expertise. Because they've got to be able to talk about what is generative AI. They've got to be able to talk about what are the tokens that are used to train these. You've got to be able to talk about what the implications in each domain might be, and to be able to understand what is being said to them by the industry, by academia, and by stakeholders. And so that's one aspect. The other is by providing technical assistance to Congress, so that we're helping to curate who they're hearing from in forums and that sort of thing. We want to make sure that they're getting good advice, and we don't have a dog in the fight. We're not an AI company. We don't, our real mission here is to ensure that this technology that the tremendous opportunity from this technology comes to fruition, and that whether those worries are hyperbole or not, let's find out. Let's find out.
Beautiful. I know we only have just maybe a quick minute left. You and I could have talked forever here, by the way, Sudip. Thank you for that. What should our audience keep their eye on? Is there some topic out there you'd say, yeah, we didn't talk about that, that's the one?
Gosh, I think we talked about a lot of them. If I had to say one thing, is that I know that the community that's out there that's watching is in biomedical research. You all, especially those of you who are early in your career, you are what give me hope in this enterprise. When I see the challenges that are in front of us, I think, my gosh, we have so many things we've got to do. But when I look at the evolution and the revolution that's happened across the biomedical research enterprise, even since the 1950s and 60s, I know what's possible. And I know, and from talking to early career scientists, that there's energy and that there is a width of aperture around the sciences that makes me think that that our best days in the biomedical research sciences, and therefore in how we are able to human beings, is still to come. It's not already past. So keep working on that, please, please, please. Your energy is what drives us.
Oh, thank God. Sudip, that went too quickly, at least from my perspective. And you are an extraordinary person, Sudip. Thank you for joining us, sharing your insights. Certainly with me, I loved it. I could have had just a cocktail with you and loved all of this, but for most importantly, the broad Hopkins community, we're really grateful to you for the time you spent today, for all that you do to advocate for science, help policymakers understand who we are, what we do, and how to make one of the most important investments, I think, which is science and biomedicine for our collective future. So I'm also grateful to everyone who tuned in today, and to also of you who submitted, the importance, really thoughtful questions. I do hope we can see you next time at the Johns Hopkins Health Policy Forum, which will be coming up in a few months. So to all of you, and Sudip, thank you for joining. Everybody stay safe and stay well.
Thank you so much, Ted. Thank you, everybody.
Pleasure, man.